Exercise is essential to a healthy heart, and especially for women.
Here to explain is Dr. Megan Wasfy, a cardiologist at Mass General Hospital. Doctor, thank you so much for joining us this morning.
Thank you for having me here today.
Well, the American Heart Association says nearly 45% of women aged 20 and older are living with cardiovascular disease in some form. That sounds like a huge number, but in your experience, how many are even aware of their risk?
Well, we've just entered Heart Month, which is February, and in this regard, we are all about increasing awareness about heart disease. And in my experience, many are surprised to hear that heart disease is the leading cause of death in women. Almost half of adult women, that 45% of women, as you point out, either have high blood pressure, a risk factor for heart disease, or already have had a significant heart event, such as a heart attack or stroke. But the good news is there's a lot we can do to improve heart health and prevent these events.
There are some risk factors, as you say, we can actually control. Exercise is one of them. So what do you tell your patients?
Yeah, with my patients, I focus on what we can control. And between lifestyle changes and medication, that's a lot in 2024, including controlling blood pressure, cholesterol, weight, blood sugars, eliminating tobacco, and improving diet and sleep. And of all the tools we have to help reduce heart disease risk, physical activity, including exercise, is really powerful because it improves many of these risk factors I just mentioned all at once. If exercise is medicine, it's a wonder drug. So I ask all my patients about their physical activity levels. If they're getting out there for a half hour or an hour most days a week, I encourage them to keep it up, especially as we're moving out of New Year's resolution phase, right? If they're not active, I encourage them to start moving, as anything, even short walks, counts towards improving heart health.
If I can just ask you, so many women living with cardiovascular disease, some may not even be aware, I guess. What are the symptoms? How would you know if you had a problem?
That's a great question. You know, my practice is focused on active and athlete patients, and in everyone, including highly active patients, I encourage them to be in touch. If they're having any new symptoms during exercise, that could be chest pain, trouble breathing, or even a reduced ability to exercise that's otherwise unexplained. And that's so we can make sure to sort out if that's something to be concerned about. Unfortunately, a lot of the risk factors for heart disease, such as high blood pressure or high cholesterol, are not things that you would have symptoms from. So those are things that are really important that you get checked on a regular basis with your doctors.
Just briefly, if we can touch on, what about women who are pregnant or going through menopause? Do you have different advice for them?
Yeah, those healthful levels of exercise that we should all aim for as a minimum, that's around 150 to 300 minutes per week, works out to that about half hour to hour, 5 days a week. That's brisk walking or similar activities. It turns out these levels of exercise are safe for nearly all patients, including in pregnancy and in older adults, though we should all follow the advice of our personal doctors. You know, we know this level of exercise in pregnancy on average improves the health of the expectant mother and reduces pregnancy complications. And, you know, exercise is also really crucial over women's menopausal years. Before this, women are relatively protected from heart disease as compared to men, but after menopause, they start to catch up. And exercise helps bend the risk factors that go up around the time of menopause back in the right direction. So it's so important for women as part of healthy aging.
Great information. I learned a lot. Dr. Megan Wasfy, a cardiologist at Mass General Hospital. Thank you for joining us.